and I'm going to make this large. There you go. So do you all see a nice big screen here? Large kidney? Perfect. So this is just a little intro. That's just me. You already heard from Chris a really very nice introduction, so appreciate that, Chris. But for the agenda today, I just want to go on some key points here. I want to talk about kidney disease and NKF's response to the COVID-19 pandemic. I want to talk a little bit about our advocacy efforts, NKF's focus on health disparities in minority populations, and of course, ways that everybody can get involved furthering this conversation. So I'm going to get started. So fueled by passion and urgency, the National Kidney Foundation, or NKF as we like to call it, is really a lifeline for all people affected by kidney disease. Every day we advocate to ensure better outcomes for the 37 million Americans with chronic kidney disease. And our long-term vision is really to eliminate preventable chronic kidney disease, eliminate the kidney transplant list, and ensure that dialysis patients have full, productive, and functioning lives. On a national platform, this is what kidney disease looks like. I know many of you already know these numbers, but I really want to give us a basis and a foundation for this conversation. So there are 37 million Americans who have chronic kidney disease, and believe it or not, 90% of them don't even know they have it. And really, it's costing our healthcare system tons of money. I mean, $120 billion Medicare spent on kidney patients just last year. And it's just, the number is just astronomical. And there are over 500,000 Americans receiving dialysis, and there are 200,000 transplant patients. And if you look to the right of the screen, you'll see that just in 2019, 95,000 people were waiting for a kidney alone, and 3,400 died waiting for a kidney transplant. And if you look to the left a little bit, 24,000 plus only received a kidney. So you're talking, these numbers are so small in terms of how the need that there is for transplantation. And it really brings us to the need for awareness of not just kidney donation, but living organ donations and just donations in general from all organs. So really excited that you guys are part of this organization, that you're part of this conversation, and that we're making moves to really change these numbers, because that's the ultimate goal. On a state level, here in Ohio, there are about 171,000 plus patients diagnosed with chronic kidney disease. 12,000 and change are on dialysis, and there are about 2,200 patients on the transplant waiting list. And again, we hate to bring these numbers up, but its reality is that 77 patients died while waiting on this wait list. So we really want to make sure that, and that's just in Ohio, right? I think the national statistic, as far as we know it, is that 12 people die a day waiting for a transplant, just in general across the United States. So that is a number that is just unacceptable in my book, and definitely gives me passion and strive to change that for the long haul, for sure, which is why I do what I do. So a little bit about kidney disease and COVID-19. Americans living with kidney disease, especially patients on dialysis and transplant recipients, appear to be at an increased risk of severe infection and mortality from COVID-19. Of course, the disease caused by coronavirus. At increased risk are those who are immunosuppressed and those on dialysis. Initial reports from Wuhan found approximately 3% to about 9% of hospitalized patients with confirmed COVID-19 developed AKI, acute kidney injury. Incidence rates have now increased to 15% of hospitalized patients and 20% and higher in ICU patients, with many requiring dialysis treatments. So AKI appears to be a marker of COVID-19 infection severity, and the mortality rate is higher for these patients. And actually, various COVID-19 related effects that are thought to contribute to AKI include kidney tubular injury or acute tubular necrosis with septic shock, microinflammation, increased blood clotting, and probable direct infection of the kidney. And most patients with COVID-19 related AKI who recover continue to have low kidney function after discharge from the hospital. So, is there somebody speaking? Yeah. I'm sure those are gasps, right? Because it's just amazing to just consider these statistics and what we're finding. So a lot of what we're finding here at the National Kidney Foundation is that, folks that prior didn't have concerns about kidney disease, are coming to us as patients, which is very unfortunate because of this disease. So since the outbreak of COVID-19, the National Kidney Foundation, we've been working tirelessly because kidney disease has not stopped. On both a local and national level, we have been actively engaging with policymakers to raise the priorities of kidney patients living on the front lines of the spread of coronavirus and have been bringing the patient's voice to the administration's response to the threat of COVID-19. So people with kidney disease and transplant recipients are higher risk for developing complications, of course. So I have a couple slides here that just shows some of our response highlights that I'm going to walk over. So we have been advocating on behalf of kidney patients and policymakers on Capitol Hill. So one, I'll just run through them. Expedited coronavirus screening for dialysis patients, dissemination of best practices in the assessment, triage, and care of dialysis patients who might have coronavirus, additional policy incentives to expand access to home dialysis, including add-on payments, expanded access to telemedicine, flexibility in training requirements, and other incentives. We're also advocating to ensure that Ohio hospitals and health systems do not discriminate against patients with end-stage kidney failure when making treatment decisions. The NKF also joined with the American Society of Nephrology in a joint letter to the Acting Secretary of Homeland Security and the administration of the Federal Emergency Management Agency in advocating for release of any remaining PPE equipment, including masks from the Strategic National Stockpile to help all patients, but in particular, those most at risk. So those include chronic disease patients, patients on dialysis, and transplant recipients. We also urge that priority access to these life-saving supplies be given to those at-risk patients along with healthcare providers. And while we recognize that many local businesses and national companies have stepped up to produce PPE and that the federal government has distributed this equipment to many states with critical shortages, more must be done to meet this urgent need. If you look at number 7, in August, the National Kidney Foundation joined with 180 other organizations and the Ad Hoc Group for Medical Research in urging congressional and executive branch leadership to reach bipartisan agreement on emergency funding for the NIH that would enhance investment in biomedical, behavioral, and population-based research and aid the federal government's response to the COVID-19 public health emergency. And NKF also joined with 39 other organizations in urging congressional leadership to ensure the needs of immunocompromised Americans are adequately addressed as it concerns legislation to help states resume some level of pre-pandemic activity, including opening of businesses and returning to school and work. And as we continue, the NKF joined with a broad coalition of public health advocacy groups in urging congressional leadership to increase COVID-19 testing in the country's most vulnerable communities, which have been hit hardest by the pandemic. And in addition, throughout this entire time, we have been involved in the passage and signing of 8 bills during 2020 alone to improve kidney policies, including promoting corporate paid leave for organ donation, FMLA leave for organ donation, and state living donor protection acts. And at the NKF, we've hosted 9 legislative briefings on COVID-19's impact on CKD community, including one to Congress. And I will say we're proud that here in Northern Ohio, and I should preempt this by saying we cover the 32 counties across Northern Ohio. We held the very first one that we did in the country, legislative briefing. So we were very, very excited to host that with our state legislators. And it went very, very well. So some of the resources that we have available, and I urge you to go to kidney.org/COVID-19 to take a look more, but NKF is a trusted resource to patients and continues to distribute patient and online resources at a wide level. For instance, some of our patient resources include shelf-stable food guide, Spanish language resources, and necessary precautions resources. These, I keep saying resources, but these series of tools really keep our community informed during the coronavirus outbreak, and they're constantly being updated and expanded and include, this comprehensive library of COVID-19 related patient resources, including information on strategies to minimize exposure of risk, like I said, kidneys, healthy, shelf-stable foods, and ways to minimize exposure at dialysis clinics. We've also have a collection of online resources. So we have gone above and beyond on doing Facebook Live programs and webinar podcasts with NKF's scientific and medical experts. We are continuing to create Facebook Live events with our medical leadership, such as one of our events with the NKF's Chief Medical Officer, nephrologist, Dr. Joseph Vasilati, who answered questions from the audience about COVID-19 and kidney disease in real time. We also held living donation virtual coffee hour sessions, local medical advisory board-led Facebook Lives, and tons of social media resources that are available at our Twitter, Instagram, and Facebook pages. And we have those 3 social media sites both on a national scale and on a local scale. So please make sure to connect with me or visit kidney.org to find out what the social media handles are if you don't already follow the National Kidney Foundation. And we also have awareness resources. We're really asking your help in this one in helping raising awareness about kidney disease and changing these numbers. We have what's called a kidney risk quiz. It's new. It actually launched back in March, and then we had to take it down, and we're relaunching it again just because obviously coronavirus took precedence over this kidney risk quiz at the time. But we're bringing it back because we really want folks, it takes 1 minute, which is why we have the link minuteforyourkidneys.org. It's a 1-minute quiz to see if you are at risk for developing kidney disease. So it's something that anybody can take. And so we're trying to make sure we raise awareness about chronic kidney disease in this capacity. You'll be surprised and shocked how many people come up to us and say, oh my gosh, I didn't know diabetes and high blood pressure were all risk factors. How did I not know this? How did my doctor not tell me? So it's just really, really great that, in less than 60 seconds, you can find out more. And the next topic I really want to talk about are really the health disparities in minority populations. At the NKF, we've been taking a hard look at how to address systemic racism and how does this transcend in our mission and the minority communities we serve. Are we doing enough? How do we change the framing and messaging of what we're doing in our programs, advocacy, marketing? How is limited access to the transplant list for minority communities a part of our larger system of health inequity? And therefore, what do we specifically do about it? And while we don't have all the answers right now, NKF is steadfast in addressing the challenging facing the community now more than ever. This is the beginning of a long-term engagement and outreach to communities at risk for kidney disease. And really on average, and I'm sure many of you know these statistics, Black or African American transplant candidates wait longer than white transplant candidates for kidney, heart, and lung transplants. Addressing So these health disparities are critically important to our mission and are necessary to help heal and save lives in our communities. And one of the facts that I put up here on the slide is that nationwide, African Americans represent 12.9% of the population, but have suffered 25.1% of deaths, roughly double their population share. Where race and ethnicity is known, of course. And really the possible reasons for this alarming impact on minority communities are a lack of access to basic resources, including food, water, shelter, and transportation, suboptimal housing conditions, employment in essential jobs with limited protections, lack of access to healthcare services, mistrust of institutions due to discriminatory experiences, and more. So what are we doing? Really the question is at the policy level. And so at the policy level, NKF is advocating for the federal government to provide all these things on the right-hand side amongst many. And so those include provide quality disaggregated data on all tests, hospitalizations, discharges, and deaths from COVID-19. So we really fully understand the scope of the problem. Ensuring priority testing, contact tracing, vaccination, and funding to high risk and minority communities, and increase the funding for kidney research and targeted awareness. And just so you all know that we have a very large government relations team at the National Kidney Foundation that is working day in and day out on all these things. And we're so incredibly proud of all the hard work that they do. This is something I'm really proud of and something we're going to be initiating here at the local level very, very soon with our local advocacy team, which is increasing voting education and polling location in all communities. So we're going to make this a really big priority, but this is happening both on a federal level, but on a local level, we're spearheading it tenfold because this is very, very important for our community. NKF is also working with congressional offices to reinforce the importance of expanding and promoting home dialysis, as well as funding new CKD and COVID education through provisions in the COVID stimulus bills. NKF also signed to expand the Family Medical Leave Act benefits to include time off during coronavirus. And we also hosted a Q&A webinar on Facebook Live with the NAACP on COVID-19 and how it is affecting African American and Hispanic communities. So we're doing a lot of great work, and we're excited to continuously be partnering with our legislators, both on a federal level and on a state level, because both are so incredibly important. And so a few extra things that we're doing. We're advertising National Minority Donor Awareness Month. Many of you already know, I'm sure all of you on this call know this, but that August is National Minority Donor Awareness Month. And really this month stems from the National Minority Donor Awareness Week, founded in 1996 by the National Minority Organ Tissue Transplant Education Program, also known as MOTEP, to bring heightened awareness to donation and transplantation in minority communities. So NKF has joined with Donate Life and other national nonprofits in promoting awareness for this month via our social media and traditional channels. We've also advertised it on our blogs, our NKF blogs. This is our CEO to the right. He's been promoting it on his personal blog that is on LinkedIn, which is seen by thousands of people, and all of our media channels. One exciting thing is that we are working on including race in eGFR scores. And in July, actually, NKF joined with ASN, American Society of Nephrology, to form a joint task force to re-examine the inclusion of race in diagnosing kidney disease. Now, historically, race has been used to estimate the eGFR, which is based on a blood test that checks how well the kidneys are working, of course. Age and sex are also used in the race with race to estimate GFR. But studies have suggested that using race can make the eGFR more accurate compared to the true most accurate measured GFR. However, the use of race in measuring EGFR has been a subject of debate, and that's why NKF and ASN have jointly formed a task force to reassess this critical issue which affects patient care. So hoping to have more updates on this very, very soon. And finally, this is not an initiative, but more of a remembrance. I did want to bring up Congressman John Lewis and his partnership with our organization. Most Americans know the late civil rights icon, Congressman John Lewis, for his role as a freedom fighter, his stewardship of the Student Nonviolent Coordinating Committee, and his leadership in organizing, of course, the 1963 March in Washington. But we at the NKF know him as a faithful champion, leader, and friend of kidney patients. I don't know if you guys all know this. His contributions to our community are endless. He introduced legislation to strengthen kidney disease research and education, promoted innovation in dialysis care, and supported efforts to improve coverage of immunosuppressant drugs. He worked to increase research funding and shined a spotlight on health disparities. He also fought to make sure every American had access to high-quality, affordable health insurance. So whether an issue was big or small, led by a Democrat or a Republican, if it was important to the kidney community, Congressman Lewis could be counted on for his support. So we put up a blog post and this picture up on our social media platforms when he passed, and in remembrance of him, because we really want to make sure that we honor everything that he really did for the kidney community. And a lot of people don't know all the wonderful things that he was able to accomplish with the National Kidney Foundation. So we're very proud of that. And if anything, it's spearheading us to do even more, right? So to have such champions and leaders behind us in our back alley is just phenomenal. And so one of the things I wanted to take an opportunity to do here today was really also talk about ways to get involved with the National Kidney Foundation. We're doing so much work on a federal and a state level. We're doing so much work really at the grassroots and grass tops level. And so, we can't do and be as effective and accomplish and create some impact with all of your support. The NKF is pivoting on a daily basis to meet the needs of our patients, our medical professionals, our caregivers, and community constituents. And so here are some opportunities that I, hand selected to talk to you all about, just as a heads up of what's coming up and ways that you could volunteer or participate or be involved with. So the first one I want to mention is our virtual, and everything's virtual at this point. So I just eliminated that word from this entire slide here. But our virtual patient symposium is on October 18th. This is a free event for patients and their caregivers. It's a 2-hour virtual seminar from 1 to 3 p.m. that Sunday, and it's filled with breakout sessions on topics such as gout, pediatric care, patient and caregiver experiences, nutrition, and a lot more. We'd love your help spreading the word about it to other patients and caregivers and physicians. We actually have a few people on this call who are actually part of our patient symposium committee. And it's it's a free event and anybody can participate and be a part of it. Some really, really great feedback. This will be our 6th year doing this program, albeit this is the first one virtually. So wish us well as we endeavor on this one. On November 5th, we have a program called our virtual Dining with the Stars event. This is a fun progressive dinner with a comedy hour celebrating our kidney patients and esteemed honorees. We're honoring Dr. Rupesh Raina at our Dining with the Stars event, and Stacy Brady, who is a dialysis tech at University Hospitals. And it's a really, all the major healthcare systems are involved, and the community at large is invited to join us for a celebratory night. It's really great. And Akron Children's Hospital always brings in a pediatric patient to speak on behalf of kidney patients and pediatric patients. So we're very, very excited about this program. And that's on November 5th. And I'm sure Chris, after this call, will share some of the details with you all. I just didn't want to bombard it with all this information. The other thing on here are renal roundtables. So renal roundtables, again, virtual, are free virtual programs for medical professionals across the board to learn more about transplantation, gout, and rare diseases. We have a program about once a month scheduled this year, starting on September 30th. And again, free program, and it's a non-CME accredited, but it's a fantastic opportunity to not only network, but really learn more about different states and phases within not only CKD, but transplantation as well. So happy to share those details with you all, as well as to when those programs are happening. But also, if you visit kidney.org/Northern Ohio, you will actually see all of these things on that website, and that's kidney.org/Northern Ohio. We also have a program called Your Kidneys and You. I love this program, everybody. These are, again, free educational presentations on the basics of chronic kidney disease. We have 4 presentations we're doing in the next few months, and we have, and we're looking for partners to host them. So we have funding to do them. We just need the opportunity to host them in different communities. So if you have any suggestions, let us know. But this, it's about a 30 to 45 minute PowerPoint presentation on the basics of CKD. We do incorporate things about gout here and there. We'll always put in local information. We'll put information on transplantation in there. So there's lots of things we do to customize them depending on the audience that we are presenting to. So love this program. And we're always also looking for volunteers to execute these programs, to be trained to give these presentations, because if all you know, we are only 3 staff members here in Northern Ohio. So we've always got our hands full, but we always count on our boards and our volunteers to assist us. And finally, this is one of my favorite programs that we host. It's called The Big Ask, The Big Give. This is a virtual transplantation and living donation education workshop we've been hosting for the past couple years. We are now doing these virtually. So we need, we have committee members that are helping us execute these, but right now with the virtual component, it's a big transition, because we used to do these in person with Cleveland Clinic and university hospitals with the transplant centers. But now we actually have I will actually share some successes. We have had now 5 people transplanted successfully through our workshops in the past year and a half. So we're very, very excited to have had 5 successful transplants. What we're doing with the virtual component is not only working with the transplant centers, but we also have a 2.0 version that is geared towards the general public to just learn about living donation and deceased donation at large, because we recognize that, while living donation is, we're really pushing for that, obviously, because organs will last longer through a living donor. It's equally as important to make sure that people, are willing to even get a transplant in the first place. You'd be surprised how many people are just shy to even go through the process, or they're scared, or they have so much misinformation about transplantation, what it costs, the pain associated. There's a lot of myths out there and misinformation. And so we have created an entire curriculum to educate folks on what it means to receive a transplant, and also the same curriculum to make folks understand what it means to be a living donor, or to sign up to be a deceased donor, in the future. So it's really, really impactful. The 2.0 version, again, like I said, is for a larger community. So it's not just folks who are on the transplant waiting list. So more information to come on that. But we're very, very excited about being able to launch and really pivot all our programs into virtual formats, because I'll tell you, none of these things on this page were virtual before COVID, as you can imagine. So the fact that, we've been working hard to transition our kidney walk and all of our other programming, including these 5 things amongst many more. We're really proud of all the hard work and the transition we've done. And then beyond all this, if anybody's interested in getting involved in our advocacy efforts, as you can see from, this entire presentation I just shared with you, there is so much work yet to be done and so much to do. We need more kidney advocacy committee members. We need more folks on the front lines. I'll tell you, next month in September, there's a virtual patient summit. And so we're going to be working and meeting with our legislators virtually to talk about all of our legislative efforts on a federal level. And so we're very excited to do that. So again, we need more volunteers, we need more support, we need more opinions, we need more professional expertise. And you all are the primary target because you've all had personal experience with this. So with that, I'll leave to my last page, which is a big thank you for the opportunity to share all this with all of you. And I'm going to stop sharing my screen and see all your lovely faces who are on this call. And open it up. If anybody has questions, I'm happy to answer them, but I'm also happy to share the presentation and even all the details and the links to our advocacy pages in the future for folks to access if you do want to continue getting involved.
Any questions for Anna?
I have a question.
Sure.
I wrote it down actually, so I'm going to put my glasses back on.
Okay.
You spoke a lot about gout and kidney, and I thought gout was a form of RA.
So gout is, a lot of kidney patients do get gout. And so that's why we have worked with Horizon Therapeutics in order to address it. And while I don't claim to be, and I'll be the first one to say, a medical professional and knowing the ins and outs of everything in regards to gout, I will say that so many of our kidney patients, especially at our patient symposium last year, loved the presentation on gout because it pertained to them quite a bit.
So are you saying that they're related, that you start out having gout, that it could relate to kidney disease?
There definitely is a correlation. I don't know that one necessarily transcends to the next, but I think that somebody with chronic kidney disease most certainly can develop gout.
Okay, thank you.
Yeah, of course. But I'm happy to even follow up after this and with additional information for you, Annette. So thank you for that question.
Okay.
Anna, I have a couple questions.
Sure.
One, you mentioned the Facebook Live events. Now, for the information on those that's going to be on the NKF Facebook page?
Yes.
Okay.
And a lot of, several of our Facebook Live events have already happened. So this was more of a recap. Now, on our kidney.org site, like you mentioned, there are, and our social media pages, especially our Facebook page, they'll be able, there's a series of scheduled upcoming events. So you'll be able to see what is coming up. But definitely when COVID-19 first started in March, technically, or the awareness of it, we were pushing Facebook Lives out like crazy. So we had, 5 or 6 within the span of like 2 months. So.
Okay. And then my other question, maybe you know, maybe you don't, but what type of things are the dialysis centers doing to help prevent spread of COVID-19? Yeah. They're in such kind of close quarters. So I was just curious as to what they were doing. Yeah, no, that's a really great question. And while I can't answer that in totality just because I'm not in the ins and outs of the dialysis clinics. I will say that every nephrologist that I've spoken to who works in and out of the clinics has told me what a safe environment that they've created. Everybody is most certainly masked up. Now, whether they have barriers or not, I'm not exactly sure, but definitely the masking and the gloving and, taking temperatures, all that is happening as is happening, really across the board
in any facility, whether dialysis or not. I think one of the major concerns that we had originally when COVID-19 first began was really the transportation bit. We were finding that there was a refusal of companies to transport people, at the time. And so that was a really big concern. And so a lot of patients were coming to us and saying, can you help us out? What do we do? How do we get to the clinic? We want to get care. And so we were doing everything we could to really make sure that that was being facilitated appropriately.
Okay. Thank you.
Thank you, Amy.
Anna, is it okay, because I actually work at a dialysis center, to kind of add on to what you said?
Please, Linda, go ahead. Yes.
So Anna is right on point when she said exactly what happens at a healthcare facility is happening at the dialysis centers, as far as, the precautions with the patients, the employees wearing the mask and the gloves and everything, and the temperature being taken as soon as the patient comes in. There's barriers where the reception area is located. Also, you cannot bring in visitors anymore to the actual facility. A lot of precautions are being taken. And the patients don't like, especially the visitors, because at one time they could bring in visitors and everything to be with them while they're being dialyzed, but that has been stopped. They can't even wait in the waiting area because, of course, we don't want all these people in the waiting area. So there has been a lot of precautions and everything because we want to have our patients as safe as possible.
Thanks, Linda.
You're welcome. And I have a question for you, Anna. Do
Sure.
you know the reason why the Congressman John Lewis was such a huge advocate for kidney health?
You know what? That's a great question. As I was reading through my CEO's blog, I was trying, because that's where I first heard about it when he passed, and I couldn't find anything from the blog itself of what his personal connection is. So I actually have it on my notes, and I apologize that I don't have that prepared for today. And I wonder if it's the connection of the African American community being more at risk, but I don't know if he had a direct connection. So I'm dying to find out as well. So I will let you know as soon as I know.
Yeah, I heard about his connection with when this month, just beginning in this month and everything, and I was just wondering, because most of the time if you're an advocate for something, it's because it's personal. So I was
exactly.
No,
I'll get in touch with you, Linda, and let you know for sure.
Perfect. Thank you so much.
Of course.
Great presentation.
Thank you.
Other questions?
Do they have age limits for organ donors? How young can they be and how old can they be?
So we have had living. You're talking living organ donors?
Yes, I am.
Assuming. So living organ donors, as far as I understand it, because we've worked with both UH and Cleveland Clinic transplant centers and through our Big Ask Big Give program, is that there is really no age limit on who they don't count it necessarily by the age of the person, but the health of the organ itself. So the person could be 75, but if their kidneys or organs are a healthy 50, or 45, then they're perfectly viable for transplantation. So they don't consider the age of the person, but the age or health of the actual organ itself, and in assessing it.
And how young?
I'm not sure of that question. I don't know how young you could be. I don't know how young.
18.
I'm assuming 18. I'm assuming 18.
You have to be of legal age to consent.
To make that decision. That makes sense. Yeah.
Okay, thanks.
Thanks, Amy.
Sure.
Those are great questions. One question that I have for you, Anna, is, you mentioned the bills, right?
Mm-hmm.
I mean, NKF, I think, is very blessed to kind of have that depth, right? To be able to, do public policy work, right? And really have an impact on Capitol Hill. I think it's amazing. But can you just talk a little bit about like, the bills that you guys are working on, like maybe a couple of the key ones and where they are. And then I guess my other question are there opportunities for individuals like us to have an impact?
Oh, absolutely. So
Right.
yes to all fronts. So one of the things that we'll tell you is we are working on a federal level, because I'm assuming you probably want to hear both. So I'll go quickly. But on a federal level, we are working on 3 primary bills. One is the Living Donor Protection Act, which is protecting those, and I think I've talked to your team a little bit about this, Chris, which is protecting those who want to become living organ donors from being discriminated against by their insurance companies and long-term health care and all that. So, we have great amount of co-sponsors and support for this in different states, because we've actually adopted this in the state of Ohio on a local level. So while the Living Donor Protection Act is a federal level, on a local level, we have tried to approach this through House Bill 41. So it's the exact same act, only it takes out the FMLA component, which is federal. And we have been working for about 2 years on this bill to get this passed. And I'll tell you, I've never, it's a game changer to work with our legislative leaders, because they've got so much on their plate and they've got a million things going on at the same time. But the process to pass bills is slow. It's slow and consuming, and we're doing everything we can. But I'll tell you, it's been 2 years since we've been trying to pass House Bill 41. But we're getting there. In addition, on a federal level, we're working on the comprehensive immunosuppressant drug coverage for kidney transplant patients. And what this is really having the government, like after a 36-month period after someone has gotten a transplant, the government stops paying for immunosuppressant drugs.
Right.
And the likelihood of someone able to afford their anti-rejection medication after that 3-year period, I shouldn't say is low, but it just gets so expensive that people are often unable to pay for them. And therefore, they either start skipping doses, right? Or they stop taking them at all. And what that does is you have rejection of the organ, and then poof, you're back on dialysis. And so some of the financials that go along with that is, we say it costs about the government $90,000 for somebody to be on dialysis per year. Okay, that's what it costs the government, $90,000 per year per patient. But it costs the government a little over $3,500 to support those same patients with the immunosuppressant coverage a year. So doesn't it make more sense to pass this bill, pay only $3,500 as opposed to the $90,000? I mean, it's just a cost effective. So we have really great federal co-sponsors on this bill as well. And we're really moving along with this quite a bit. And the last one is the appropriation funding requests. And this bill is really is just talking about Kidney X and some of the chronic kidney disease initiatives where we're working with HHS and ASN to incentivize innovators to fill unmet patient needs through a series of prize competitions focused on technology development and commercialization for the prevention, diagnosis, and treatment of kidney disease. And so we're really trying to increase funding for this and really try to get, the recommended funding level is about $25 million that we're trying to get. And there's a series of, so that's Kidney X, but there's other initiatives and funding for the Living Donor Assistance Center and the CKD Chronic Kidney Disease Initiative. So in total, we're looking at about, let me do the math, $35,000, $45,000, $50,000 plus that we're trying to get funding for through these requests. Because what we have found, and Chris, you'll be amazed to hear, is that, I don't even know if it's surprising, but that breast cancer research gets so much funding, right? Which is why they've progressed so well in terms of cures and treatments and so on and so forth. And yet we now have more kidney disease patients than we have breast cancer patients. And we're getting a sliver of the pie. And we just can't move the needle forward without appropriate funding from the federal government because, our hands are tied. So doesn't it make more sense to put more funding into innovations, research, and all that that goes behind it? And as you all, I'm sure, know on this call, is that kidney disease is only going to be even more prevalent. And with COVID-19, with the onset of even more kidney patients, it's just more and more and more and more. And that is why part of this patient summit, not part of it, the reason why we're having this patient summit next month is to talk about these 3 federal bills. And so, but on a local level, finally, other than the House Bill 41, we are going to be doing a lot with, while not a bill, we're going to be working a lot with voter registration and making sure that ballots are available in all communities as much as we can possibly make that happen. So we're excited for all things advocacy. And to answer your final question, my gosh, we need all the help we can get. So if any of you want to join our committee, and we're working with a social worker and one of my board members to really spearhead these efforts on a grassroots level, because I think that it really starts from the bottom. While, we have a wonderful government relations team, the people that are going to care about Cuyahoga and Summit County and Geauga County are going to be us, right? First and foremost. So we got to make sure that we're the boots on the ground and we're making a difference here first. So I welcome all of you to join. Call me.
Oh, that makes sense. Thank you for that. Yeah.
Of course.
Because I think, we hear about these big efforts, that are kind of occurring. And, I guess, if you're not kind of tapping in, all the time, you're not kind of sure where, you are in that process. And I think there's a lot of people that just feel like they, like they would want to do something, but don't know how, right?
Yes. Yes.
So that's really helpful.
No, absolutely. And I can keep you posted on, once our advocacy committee meets, we're going to be making some long-term plans here at the very local level on, okay, what are some really tangible ways we're going to get involved in the community? So we're going to need as many people hands on deck. So I'll be reaching out for sure. And we're very excited. And even on the federal side, I think the number one way everybody on this call could really assist is, going on the website on kidney.org/advocacy and reading up on the 3 different bills and writing. We have templates where all you have to put your name and email address, whatever it might be, and send letters to our congressmen and our legislators at the federal level, because the more letters they receive from us, knowing that people care, the more they're going to act on it. And it takes everybody's voice to make a difference. And so that's number one way you could help right there.
Great.
Thank you so much for all your questions. I really appreciate it.
I have one more.
Sure.
House Bill 41.
Yes.
Who's the main sponsors?
So Representative Hambley and Representative Hicks Hudson are the 2 sponsors of that bill. And Representative Brinkman, who is the Speaker of the Insurance Committee, he is helping us really spearhead and make sure that we're getting in front of the Insurance Committee to really launch this and get their buy-in as much as possible. Mm-hmm.
Okay.
Yep.
Thank you.
Of course. And if you need the language or a copy of the bill, I'm happy to send that your way as well if you'd like to get the details. Okay. Happy to share that.
Anyone else?
Very quiet, Chris.
I know. Sometimes when I wait like a little more, something pops in someone's head, right? So I don't want anyone to feel uncomfortable, but Well, this is great. Anna.
I answer to both. It's all good.
Yeah, I think I say that all the time. Anna, no, Anna. But thank you so much for being with us, today and really getting us up to date, on things that are happening from an NKF perspective. I know that everybody, on the call appreciates it as well. And thank you so much.
Oh, thank you so much. I appreciate all of you and this opportunity. And I welcome any more questions. I'm happy to, Chris, I'll send you a huge email with all the from all these questions that we got with just resources and next steps for everybody. So,
We can share it with our membership. So that's
please, yes, thank you all.
awesome. All right. Well, if there are no more questions, we'll go ahead and, close this session. Thank you all for attending and have a great night.
Thank you.
Thanks, Anna.
Thank you.
Thank you.
Thank you.
Bye, everybody.
Thank you.
Bye-bye.
Thank you.
Bye-bye.
Thank you, everybody.
Mm.